I'd like to thank you for joining today's webinar on shared measurement. My name is Chelsea Karst, and I'd like to take a brief moment to talk to you about the Ontario Trillium Foundation and why we've partnered with Tamarack to deliver this webinar series. If this is the first time you're hearing about the Ontario Trillium Foundation, there are two important things you should know. First, we are an agency of the Government of Ontario, and second, as one of Canada's leading grant-making foundations, we fund over $100 million to support projects in communities across Ontario every year. The mandate of this foundation is to build healthy and vibrant communities across Ontario, and we use our action areas to define what we mean by that. They are a vision and what we aspire to achieve. On the screen, you'll see those 6 action areas. They are active people with the goal of fostering more active lifestyles, connected people, which is aimed at building inclusive and engaged communities, green people, which is all about encouraging communities to support a healthy and sustainable environment, inspired people with the goal of enriching lives through arts, culture, and heritage, promising young people, which aims to support the positive development of children and youth, particularly those who are facing barriers, and finally, prosperous people, which looks to enhance Ontario's economic well-being, moving people from crisis to economic opportunity. We believe if we can make measurable impact in those 6 areas, we will be able to achieve our foundation's mandate. Following this webinar, if you have any interest in learning more about the Ontario Trillium Foundation and its funding streams, you can visit our website at www.otf.ca, or you can contact our support center directly using the phone number or email on the screen. We hope that you find today's webinar helpful for your work.
All right, thank you so much, Chelsea. It's now my pleasure to introduce your webinar speaker for today, Mark Cabaj. Mark is president of the consulting company From Here to There and an associate of Tamarack Institute. Mark's current focus is on developing practical ways to understand, plan, and evaluate efforts to address complex issues. He has firsthand knowledge of using evaluation as a policymaker, philanthropist, and activist, and has played a big role in promoting the emerging practice of developmental evaluation in Canada. Welcome, Mark.
Thanks, Duncan, and thanks, Chelsea. Good day, everyone. It's a pleasure to be here. As we were preparing for the webinar, I was commenting that Tamarack has been doing these since 2002. So I think this is 16 years in that Tamarack has been doing webinars, and the co-evolution of technology and the way people interact, it just gets better and better and better. So I really like doing Tamarack webinars. The topic today, shared measurement and evaluation, is both intriguing and important. So I'm looking forward to talking about something that preoccupies a lot of people in Canada and across the world, quite frankly, about how do we work together to tackle complex issues and what is the role of shared measurement in that. As we do this, I want to point out the title in this slide here, The Inevitable Evolution of Ideas and Practice, Including Shared Measurement. A couple years ago, 2016, I think it was, Liz and I were, Liz Weaver from Tamarack, musing about some of the friction we were feeling in the collective impact discussion with people who liked the general ideas of collective impact, but were really struggling with the practice. And we were noting that part of the challenge was people felt that a lot of people were hoping that these initial ideas and exemplary practices were the recipe for going about collective impact, and were frustrated that the practices weren't more fully developed or always seemed to change from community to community. So we actually wrote a paper called Collective Impact 3.0 and made the point that the collective impact, the idea and practices of collective impact, have actually constantly evolved from a period that we called Collective Impact 1.0, where a lot of people were doing it, but we didn't have the framing of it. The Collective Impact 2.0 period, which was when FSG kindly did such a good job of framing the general approach and made it explicit for people and engaged a lot more innovators and early adopters. And we proposed the 3.0 period, where all of us would reflect on our lessons a little bit more and then share the evolution of ideas and practices, all of which organized around the main themes. And I'm not going to spend a lot of time, any time, quite frankly, talking about the 3.0 framework that we developed as a way to provoke others to come up with their own insights and reflections. But we are today going to focus a little bit more deeply on the shared measurement dimension of that. And I will note that there is a paper that I wrote on this that I think is linked to this webinar called Share Measurement, the why is clear, but the how continues to develop. And we'll be mostly focusing on that in the call today, although I'll add a curl or two that has emerged since that paper was developed, and I've learned more as I've shared these ideas with others. So with that in mind, I'm going to spend a couple minutes on the basic idea of collective impact, give you an example or two of it in practice, confirm some of the challenges that collective impact practitioners have raised, and then going to go over 6 ideas that could make shared measurement even easier and more effective in this next iteration of our experimentation with collective impact. So here's the basic idea. Collective impact is considered one of 5 basic conditions of collective impact approach in general, and this is from the original 2011 framing. Those agenda items, and I'm going to say shared measurement left, are having a common understanding of the problem and a shared vision for change, trying to have mutually reinforcing and coordinated activities amongst diverse stakeholders who are all trying to achieve the same outcomes, constant and continuous communication between players, all supported with backbone support, because we know collaboration doesn't happen on the side of its desk. It needs someone to sort of be the general contractor for change, as all of us specialists come in and out of a change process. And a cornerstone feature of collective impact is this idea of collecting data and measuring results in a way to track progress and encourage shared accountability. So here's the very basic idea. It's one of the cornerstone conditions. And we know that the collective impact approach was framed with a lot of good examples and case studies to demonstrate some of these key ideas. The shared measurement why is obvious, pretty obvious, and John Kanye and Mark Kramer make this very clear in their opening article. Collecting data and measuring results consistently on a short list of indicators at the community level and across participating organization not only ensure that efforts are aligned, it also enables participants to hold each other accountable and learn from each other's successes and failures. So that's the why. Why would we do shared measurement? We want to make progress over time, hold each other accountable, and create at least contribute some data that might provoke or invoke and engender some kind of learning. So what is shared measurement? This again is from an FSG slide, and it's nicely done. It asks, are we making progress, and opens the possibility for us to use information to make better decisions. We're going to talk a little bit about the struggle of that shortly. And it is not meant to measure the impact of a single organization, simply gathering data not used on it, focused on only programmatic outcomes versus systemic and population level outcomes, which we'll talk about, meant to be punitive, meant to foster competition, to be done once in a while and only retrospectively. As we'll see, it's not meant to do that, but it often does do that because it's part of the general field of evaluation, and evaluation always struggles with how to handle these things. But this is what it's meant to do. It's also important as we proceed to make a distinction, which the FSG group does quite nicely, the distinction between evaluation and shared measurement. Shared measurement is gathering data on a select group of indicators on hoped for outcomes and changes. And evaluation refers to using that data to make decisions about activities, characteristics, and outcomes of the initiative overall. So shared measurement is collecting and making sense of data, and evaluation is interpreting that data and making decisions about how it's used. And we're going to emphasize that in one of the points coming up, but we do know that there's a distinction between measurement and evaluation. Here's an example of shared measurement in practice. The Roadmap project in Seattle, which has a very clear vision, and some would argue an excellent SMART goal, which is to double the number of students in the county and South Seattle who are on track to graduating from college or earning a career credential by 2020. So very specific measurement. And the vision behind that, or the mission, is committed to closing the unacceptable achievement gap for low-income students and children of color, and increasing achievement for all students from cradle to college and career. Many of you will know this case study along with the other case study of Strive in Cincinnati. A lot of the shared measurement practice and ideas have come from efforts that have focused quite a bit on educational achievement. And we'll speak to that as well about how that's really promising, but how that's not the only example we should be looking at. So let's take a look at the kinds of things that the roadmap project would look at when all these stakeholders came together, and there were scores of them. They did create this cradle to grave approach to strategy, which has indicator implications behind that. So you'll see they have a readiness stream with healthy and ready for kindergarten kids, and they have a very simple measure there, number or percentage of children ready to succeed in school by kindergarten. They have indicators for that, but that's their measure. They have supported and successful in school. You can see they have a whole continuum of grade 3, 4, 5, 6, 7, 8, 9 different milestones and thresholds they want to see in terms of grades in different topic areas. They have a stream of indicators from high school and college and career, as well as post-career. So this is one of the easier things to track, the evolution of kids from cradle to career in the educational field. And you'll find that when you look at a lot of collective impact efforts, they mostly focus on this kind of thinking. But it is comprehensive, and it is a shared story around which many organizations can organize their efforts. So nice project. When they start producing reports, and it takes a while to produce these reports, they do generate the kinds of things that we would expect them to see, and in fact are kind of data that are available to a lot of educational initiatives already. You have roadmap region and you have benchmark regions where they benchmark their own indicators, and you could have indicators tracked over time with the unavoidable different colors and arrows showing where there's progress, no progress, or causes for concern. So the idea is simple in its conception, but it's a lot more tricky to do in practice. But if we can do it, it can improve clarity of thinking, of strategic thinking. What are the outcomes we want to achieve? Can help progress towards a shared goal. It can enable collaboration and coordination. It will inevitably raise questions about data quality, which can raise the bar on data quality, which is good for all of us. It possibly can contribute to continuous learning, and it can catalyze action. So these are the hopeful things, the hoped for things out of shared measurement. And in order to achieve that, people have proposed, and this is pretty consistent across most shared measurement approaches, a very simple design process, which we'll come back to later, called the waterfall process. We design the system, what kind of indicators we want to get, how will we go about doing it, developing the instruments and the analytical processes and sense-making processes, and then we deploy it and fix out kinks as they go. But this is a pretty kind of conventional plan the work and work the plan approach, which I'm about to contest in about 10 minutes. But this is what's interesting about this is almost every different shared measurement resource you see refers to this kind of relatively linear process. The challenges in taking that simple idea and putting it into practice are the things that we could all anticipate. It's not easy to get diverse people to come to agreement on common outcomes and indicators. It is very difficult to compare across different providers. People will talk about apples and oranges comparison. We'll come to that shortly. It takes time and energy to do this, and we're all in short supply of time and energy. It's also tricky to get alignment amongst funders, as we mentioned in another article on evaluating shared measurement or a collective impact called 5 Simple Rules. Many of the fragmented measurement systems we have in our communities today are simply a reflection of the upstream fragmentation of policymakers and funders. So some organizations I've worked with have 25 different funders and 25 different measurement systems to please different funders. And it takes time and money. So this is a real quick introduction to shared measurement, the why, the key features, the steps to unfolding it, the benefits and the key challenges. And this is a summary that you can all read on the oodles and oodles of stuff on shared measurement out there. What we want to introduce now is 6 ideas that reflect a 3.0 orientation from our view. And it doesn't mean this is your view. We welcome you to come up with your own insights, but things that we think we have learned that can improve the ideas and practices of shared measurement and collective impact. So we're calling them 6 emerging principles. They could be 6 emerging ideas and associated practices. And let's begin with this, a quick summary. Be certain about the outcomes we want to achieve before we commit heavy to developing shared measurement systems. Distinguish between shared outcomes, shared measures, and shared measurement. This is a really important one. Embed shared measurement processes into effective learning and decision-making processes. Employ an agile versus big design upfront approach to developing these systems. Beware of and respond to perverse consequences, but as we'll see, they're almost impossible to avoid. And balance the use of shared measurement for both learning and accountability. So I'm going to go through these fairly quickly in about 25 minutes, and then we'll open it up for questions, and Duncan will be grabbing your questions as they emerge as well. So number one, be certain about the outcomes we want to achieve before we actually develop a system. Here's two real quick vignettes, and some of you have heard this one I've mentioned before about an example that we had in vibrant communities in Surrey. But I use these two contrasting stories because they so clearly point to the need to be not rushed to measurement discussions before we're clear about outcomes. A couple years ago, I was in the United States at an international discussion around how to reduce the number of children in residential care in a Southeast Asian country, where families were who were impoverished were sending kids both to orphanages as an economic development coping measures, but also there was a whole tourist industry organized around people going to work at orphanages, and people were thinking the better strategy is to actually create resilient and economically viable families. So they really wanted to reduce the number of kids in these what they called orphanage tourism. We had 2 days of discussions around measurement implications, and we did not have one discussion about what the shared outcomes were. And that was revealing in the sense that we got into statistics and indicators and validity and reliability and what could you measure, etc., all without any context whatsoever around what the outcomes were that we wanted to measure. And we see this in a lot of cases where people put together measurement groups well before the strategy for the collective impact effort is laid out and the outcomes that are priorities outcomes are laid out for them. In contrast to that, a group in Surrey not so long ago, in 2006, I believe it was, they too wanted to have a collective impact effort to tackle a complex issue, but they didn't really understand what the outcomes they wanted to achieve were besides reducing the number of homeless day laborers. And what they did was they committed themselves to a couple of 6-month sprints to what we would now call a human-centered design process, where they followed homeless day laborers as they went about their day-to-day work. And when they found out that homeless day laborers couldn't get into shelters because they were working and shelters didn't allow them to be involved because they were making money and they were only set up for people receiving welfare, they changed that public policy and quickly said getting access to shelters is a short-term outcome. Then they learned that temporary agencies were taking over 50% of the pay for homeless day laborers working on construction sites, and so construction homeless day laborers, rather than getting $16 an hour, were getting $8 an hour for cleaning up these sites. They addressed that. They created their own intermediary to come up with work with construction companies without charging a fee, meaning homeless day laborers could get $16 an hour. They created an outcome of getting patched income patching as an outcome. When they found out that homeless day workers couldn't cash their checks because they didn't have bank accounts, because you can't have a bank account if you don't have an address, they also added the outcome of access to financial products and services. Long story short, through a relentless process of trial and error, a group that started with nothing, only a vision of reducing the number of homeless day laborers, through a process of trial and error, developed an outcome set of 5 or 6 different outcomes that were required to achieve reduction of homeless day laborers, patched income, access to housing, access to financial products and services. Then they were able to have a discussion around what kind of measures they would want to see and what kind of measures they would share. This really shows us that strategy in collective impact effort often isn't planned. It emerges over time. And we have a general sense of where we want to go on the left-hand side. We try stuff out. We learn about what works and what doesn't, what might be a legitimate intermediate outcome, and we might even have a different understanding of the end game outcome after we do a bit of trial and error. Whether we can plan something up front or whether an evaluation desired outcomes emerge through a process of trial and error, we need outcomes before we start committing heavy to shared measurement systems. I won't actually go through this, but this does describe a distinction in collective impact efforts from emergent strategies where the end game is clear, but we learn how to get there through trial and error. On the right-hand side, we see detailed strategies where we've done all that stuff in the boardroom. We've planned things up front. We know the end game. We know the intermediate results, and therefore we can then commit heavy to shared measurement systems, to umbrella strategy, where we have some outcomes clear that we want to measure, but the rest of them we're not ready to commit to yet because they're either too diverse, things are too decentralized, and we can only find common ground on a couple shared outcomes. So outcomes before measures is really the simple story behind this point. Let's go to the next one to distinguish it between shared outcomes, shared measures, and shared measurement. This one is spooky simple, but I find that it's so easy to mess this one up. And I've been involved in lots of moments where we've messed this up, particularly in the early days. But I'm happy to say that we don't make this mistake that often anymore. Here's an important point. Here, and I'm going to illustrate it with two different case studies, ending homelessness in Calgary and a cradle to career initiative organized around schools. So when many of you will be involved in ending homelessness initiatives and know the pressure to come up with management information systems to track that. And in fact, this is a case study where we need to introduce new shared measurement systems because the infrastructure doesn't exist right now. And if the outcome is shorten the time between shelter and permanent housing, which is one of the key outcomes, let's make the distinction between measures and measurement. The outcome is shortened time between shelter and permanent housing. The measure is a length of time in the shelter system. Some people have targets as less than 7 days. And the measurement is all shelters in a city input the time of stay into a homelessness information system. Shared outcome, shared measure, and in this case, a lot of shelter providers have to embrace a shared measurement system and buy into this homelessness information system. Let's contrast that to the educational examples that are rife in the collective impact field, where people may have a shared outcome. Let's say that people agree that it's success in grade 3. Their measure is some semblance of grade 3 success measures on reading, writing, arithmetic, etc. And the measures might be scores on reading tests. Now, here's the thing. We could all agree on those outcomes. We could all agree on those measures, but only the school system needs to be involved in gathering those scores. You don't have to have mentoring programs and counseling programs all of a sudden buying into a big shared measurement system and adding even more measurement work to their groaning workload already. In this case, one organization already has the capacity to gather those measures. So whether it's a shared measurement system, that's not entirely clear, but there is a distinction between agreeing on an outcome, agreeing on a measure, and then knowing that depending on the initiative, your shared measurement system might be really big, like in the homelessness case study in Calgary, or your shared measurement system might be quite small, as in the case of cradle to career initiatives, because many of the, if not most of the measures are already being gathered by one organization, and that's the educational system and school boards. So we're going to add a little curl here. Be clear about the object of about the shared outcomes of the project. Be selective about what measures should be shared, and be hyper selective about what things need shared measurement. Shared measurement may be quite small, may not be quite big, and if you can make that distinction early, you can save yourself literally hundreds of thousands, if not millions of dollars. Number 3, embed shared measurement process into effective learning and decision-making processes. This is a very simple thing that FSG pointed out, and we want to elaborate on the distinction between gathering data and using it. And the case study we've used a couple of times is an iconic one. In the 1970s and 80s, General Motors was a very data-heavy organization. They collected a ton of data on everything, and they did tons of reports that were aggregated up from frontline to department to unit to division, et cetera, all the way up. And they had lots of data, but they actually didn't have processes to make sense of that data, particularly on the lower ends, because it all went up the hierarchy to the top end where they would look for big patterns and themes. But the challenges was this data came late, it was decontextualized, people didn't know how to use it, and the people on the ground level weren't actually inputting good data after a while because they didn't see the value in it. They were simply going through a credentialized exercise. So General Motors, the traditional bureaucratic heavy approach was accumulate data and report it up, but don't really have strong learning processes. Toyota, in contrast, was on the ascendancy at that point in time. I know it's not in anymore. It's not nearly the company that it used to be in terms of quality and etc. and performance, but they were data light and learning heavy, and they would have some shared indicators, but those indicators wouldn't be a lot of them. They'd be a select group of indicators, but their processes for interpreting that data and just using that for decision making was really elaborate. And this is from the Kaizen continuous improvement models and culture taken from Japan. And what would happen is the decision making and sense making was so decentralized that someone on the line could stop something if they saw a mistake, and they would say, hey, how come we've got some glitches here? Let's go through some sense making processes, including something like the 5 why. How come the door handle's not working? Because we didn't install it right. How come we didn't install it right? Because the line was moving too quickly. How come the line was moving too quickly? Because we didn't catch up on yesterday's order, et cetera, et cetera, et cetera. That process of making sense of the data and then being able to, in real time, make adjustments to the way the flow was working, the workflow in the unit itself or working across units. They had fairly simple but well-embraced protocols for people to use data. So not a lot of data, but certainly more processes for making sense of that data and using it to inform decisions. This is a challenge we have in Western society, as we'll see right away, that we are data heavy and sense making and decision making light. And we have an example in the shared measurement article, which was we're going to call it superficial benchmarking in a nutrition program overseas. And in that little vignette, a program officer shares a story about getting benchmark data with her and her colleagues around nutrition rates in different villages, and particularly around vaccination. And the data came in, and her program benchmarked poorly against the others. And what happened immediately was she was sort of penalized and berated for not having data as good as her benchmark peers, when in fact the question was, why is her data and her performance at her site not as good as the others? Are the sites different? Did she come in at the same time? Are there other contextual factors that would warrant a difference of approach? Did she have the same resources? Asking why the data is different is important before you rush to judgment about what to do about it. So in the paper, the how is clear, the why continues to develop. Take a look at that quick little vignette. But I think we do that all the time. We see data and we rush to snap judgments. And Malcolm Gladwell has looked at this extensively in his book called Blink. We're all very good at rapid cognition, but sometimes, and in fact, I would argue all the time, when we have data that means something, we should slow down, take a little bit of time to make sense of the data and figure out how we're going to use it. This gives us the following image, which is, in particularly Western society, we are often data rich, but sense making and decision making poor. So collecting data is useless without paying attention to these other two processes. Here's some practices that have emerged in some of the stuff we've done. Paul Bourne is responsible for the first practice. He shared this with me and I use it quite a bit now. What if you brought together a group and you said, here we agree on the outcomes, we know the distinction between shared measures and shared measurement, etc. And let's not collect any new data for an entire year or even 6 months. And let's actually figure out if we've got good sense-making processes and decision-making process, and build that muscle for a while, and constantly testing the usefulness of data. And once you were good at the sense-making and decision-making, then you could say, now we're good at using data. Now let's turn our attention to addressing some of the data gaps that have emerged through this process. So in fact, this is kind of odd. Start downstream first, sense-making and using existing data before collecting even new data. A very simple practice, but one that could save you a lot of time and energy and dramatically improve the chances that the data you gather are actually going to be used to inform decisions. Okay, let's go to the last three. Employ an agile rather than a waterfall or big design upfront approach to developing shared measurement systems. I am actually not the person to be waxing eloquent on this too much, because software designers are the folks that introduced us to this. And the idea is very, very simple. The idea of a big design up front versus an agile approach is captured in these two stories. I know one story of, and I won't share the name, particularly since many of you may know some of the people involved, where they spent almost 3 to 4 years developing their idea system before they implemented it. And of course, you know what that was like when you're developing big systems up front. Get ready, design, keep designing, more problems come, keep designing, get ready to implement, don't implement yet, there's some glitches, wait, kind of get ready to shoot, but don't shoot, just wait. And then we struggle with the possibility that the system we designed has imploded under its own weight because it's so big, has got things that we can't fix because they're part of a bigger design, or is no longer even useful because our emerging strategy has evolved and our big clumsy data system has not co-evolved with it. In contrast to that, there's a case study here in Edmonton where a collaborative group that was really under the wire to get a diversion project up and going quickly, which included as its focus helping people who were vulnerable, diverting their showing up at hospital emergency rooms or having interactions with the police, which was often inappropriate because their behavior wasn't criminal necessarily, nor were their needs primarily healthcare driven. How could they divert those people to services like shelters and counseling and general support before they got into those deeper crises requiring medical and police attention? Well, through a series of 30-day and 90-day sprints, they developed a system in little chunks. They would say, let's learn how to gather this data really quickly on these 3 indicators. Let's see what we can accomplish in 30 days. 30 days later, let's add another measure. 90 days later, let's integrate it with the real-time app. Another 90 days later, let's even improve the volume of data we're collecting and the nature of our decision-making when we get it. They didn't use a big design up front. They built their data system in little chunks in very quick sprints. Let me give you an example of that. This is a diagram taken from the web, which talks about the 2 different approaches and contrast them. The waterfall up front approach, again, is roughly the same as proposed by many software design firms. Define it, get lots of scopes of workout, a lot of specifications, build it, do some beta tests, release it, and then hopefully it adds value later on. The agile approach, which again is from software, says define little chunks of it, build it in quick sprints, release it, learn, improve, add another little chunk, improve the existing chunk, and through relentless incrementalism, build a data system piece by piece, which not only minimizes the risk, but allows you to see valuable pieces of data coming in faster than you could with the big design upfront approach. This stuff is actually quite well researched, and there's a group called the Standish Group, which does research on this, and here's some of their research findings. The waterfall process, the big design up front, has a success rate. By the way, when they do this, they survey something like 14,000 companies a year. And it's mostly on data projects and software projects, but the principles are relevant for us as well. Waterfall project, successful 14% of the time, agile 42% of the time, failure 29% of the time in waterfall, and 9% of the time in the agile approach. Folks, this is a very simple idea that where there is a little bit of skill required in its application, but everyone can handle the idea of 90-day sprints or 30-day sprints, building shared measurement system in chunks. We did it really quickly in the 24/7 diversion project in Edmonton. If we could do it, and we could do it that quickly, and within a year having a full functioning real-time app with excellent data that is used, almost anyone can do it. So I encourage you to embrace the idea of agile. Let's move on to perverse consequences quickly, and then the last phrase. the last section on weaving together accountability and learning. So in the paper, the how is clear, the why is clear, the how continues to develop. There's a case study, a well-documented case study in the United Kingdom, where targets for reducing wait times were publicly shared and used for management decision-making and even incentivized in hospitals in the National Health Service in the United Kingdom. And the target was to see people within 4 hours. This is a very important case study for Canada, which also struggles with wait times. What they found was they eventually made that benchmark, but all these perverse consequences began to emerge, including refusing patients who could not be seen within the 4 hours, manipulating data to improve the prospects that things look good, and ignoring entirely other clinical priorities, to the point where in one case study, several deaths were recorded, and the examiners determined that they were linked at least tentatively to the pressure to reduce wait times rather than spend time on other priorities as well. There are tons of perverse consequences, as we're going to see right away here. And the idea here is, this is hard for me to accept. It might be hard for you to accept. They almost can't be avoided, but they have to be acknowledged. And what we have to do is address them if and when they emerge. So in the case study of the hospital wait times, what they did was they agreed to continue to track that, but they didn't publicly declare them to create that perverse incentive to look good. And they reduced the number of incentives to focus only on good outcomes for wait times. And they expanded incentives to also generate good outcomes in the other clinical priority areas as well. So they adapted. Here's a couple of perverse consequences from this famous study of performance management in the public sector from the UK. I'm not going to read through all of them there, but some of them are tunnel vision. You only focus on targets that are easiest to measure. Measure fixation, you focus on outputs rather than outcomes. Ossification, you continue to use indicators that are no longer useful, a real problem in collective impact efforts where strategy and outcomes continue to emerge. They are endless. So beware of these perverse consequences, spot them, and get ready to adapt if and when they emerge. They're almost unavoidable. The last point that we want to make, and then we'll summarize it and open for questions, is to balance the use of shared measurement for both learning and accountability. So here are, I'm going to make a straw dog argument here, two different purposes, accountability and learning. Accountability is, did we implement our work as planned? Did we meet quality and ethical standards? And did we make satisfactory progress on desired results? Learning is, what are we learning about the challenge and how to address it? What's working, what's not working, for whom, in what context, and why? What's in and out of our control, what's happening in the system, and so what are we going to do with it now? So these are artificially separated for a moment, but they do kind of represent two kind of cultures or priorities or drivers in the evaluation world that will for certain show up in the shared measurement system work that we want to do. And when you put these two things together, we acknowledge that both of them actually have a shadow side if you emphasize one over the other. If we emphasize accountability too much, what it can do is generate inappropriate expectations, rigidity in thinking, very superficial learning, as I hinted at in that case study of the woman having her nutrition program benchmarked against others. It can create a blame culture without really understanding about why outcomes were achieved or not. And there's all these gaming behaviors that we looked at briefly in this perverse consequences. So that's the shadow side of accountability. There's also a shadow side of excessive focus on learning without being accountable for outcomes and meeting basic standards. We can have insufficient expectations, lose commitments, there's weak momentum, there's a recorded loss of agency where learning for learning's sake without trying to achieve outcomes makes people feel less efficacious, and it can contribute to drift. So what do we do with these two things? Well, I'm going to channel Adam Kahane at a lecture I saw him make with his book on Power and Love, where he uses this case study. Oh, by the way, I should show this. I love these quotes. We're lost, but we're making good time. A great quote by Yoga Berry, which emphasizes learning without accountability. But the vignette I wanted to share was a Greek myth around Euripides and Scylla. I think Scylla was the seven-headed monster, and Euripides was this whirlpool. And Odysseus, in one of his adventures, trying to get back home, had to navigate both. And if he focused too much on Chiripides, the learning part, he would get sucked into this whirlpool. If he moved too closely to Scylla, the seven-headed monster, he would find problems there. So how does one navigate productively both of these pressures, because we need both? Well, here's what the merger can provide for us: a productive tension between weaving together both accountability and learning. Can we get sustained progress on desired outcomes? Can we have fidelity to key principles? Can we employ robust tracking and learning process? Can learning be an accountability? And can we acknowledge the need to avoid rigidity and to have data-informed adaptation of goals, targets, and strategy and implementation arrangements? If and when our learning tells us that the strategy and our implementation model needs to change, it is accountable to adapt. It is unaccountable not to pay attention to that and keep rigid simply because we committed to a certain way of a certain strategy and implementation model when we began the collective impact process. So let me go over those 6 things again, but before we do, I want to embed evaluation in a broader process of learning in general, and I'm going to channel the great Michael Patton on this, where shared measurement is simply part of the evaluation journey. It's simply yet a new niche, maybe not even a new niche, but a reimagined niche for assessment, where we have to get good at it. And here's Michael's quote: "Getting people to taste evaluation and measurement may indeed be a long shot. Many people have been made sick by past concoctions called evaluation. Each evaluation or shared measurement being a blend of unique ingredients, no standardized recipe can ensure the outcome. We only have principles, premises, and utilization processes to guide us. But the potential benefits merit the efforts and risks involved. At stake is the vision of an experimenting society. The only way to find out is to try it and evaluate the results." We at Tamarack have been working at shared measurement along with you for quite some time. We've experimented alongside with you. We've watched your experiments, and we agree with the why of shared measurement, and we acknowledge that the how continues to develop. And here are simply 6 of our ideas about how to make the next iteration of experimentation even stronger. Thanks for that. I think I'm going to turn over to Duncan now to facilitate our question process, and we have a little bit of time for that. So Duncan, let's see how we do with this.
Thanks, Mark. And just a reminder, we have about 10 or 15 minutes here for Q&A. So if you haven't sent in your question, feel free to do so now. Our first question is from Jessa. They write, "Any examples to discuss of intervention course corrections and the impacts it had on shared measurement, whether positive or negative?"
Thank you. So my understanding is, are there examples of people who've made mid-course corrections on their strategy and whether it's led to an evolution in the shared measurement system? If I understand that correctly, I will speak personally about one, and that is the Vibrant Communities Initiative that ran from 2002 to 2011. And there's plenty online written about this. And this case study that I'm about to quickly summarize is actually in Michael Quinn Patton's book, Developmental Evaluation Exemplars. When we started Vibrant Communities Canada with 15 urban networks from across the country, all the way from Victoria to Halifax and St. John's, we agreed on a very simple outcome framework, which looked at poverty as a lack of income. And we knew poverty was a lot more than that. But in order to develop a shared measurement system that we could all agree to, we agreed to that lowest common denominator approach to measurement and agreed that we would return to whether that was the right outcome measurement framework over time. Over the length of the 3 years, we went through 3 different chapters of learning about what poverty was and how best to measure it. And at each point in time, we upgraded our shared measurement system. So where we began with a shared measurement system that was organized around poverty as a lack of income, 2 years later, we realized it was more complex than that and agreed to a more elaborate system that was based on Maslow's hierarchy of needs. And we had access to housing, access to food, access to income, access to a couple of other things, and agreed to work with that for a couple of years. as we did that and learned even more about the complexities of poverty and its multidimensionality of it, we agreed in the third chapter to embrace something called the Sustainable Livelihoods Framework. And the Sustainable Livelihoods Framework was an asset-based approach to poverty reduction, which said poverty reduction is really creating the conditions for vulnerable people to accumulate assets. Assets being education, social networks, access to services. In fact, there was 26 developmental assets in the Sustainable Livelihoods Framework. And the framework also confirmed that we needed to address strategy at both a programmatic level and at a systemic level. So we always had two-tiered strategies. That strategy was actually, that measurement framework was introduced 10 years earlier, but we couldn't get, or 7 years earlier, but we couldn't get agreement on it because we didn't have the shared learning. But it was very easy to agree on it 7 years in, and that ended up being our final evaluation framework. Much more sophisticated, and it certainly framed how we thought about strategies. So that is a really well-documented case study of the evolution of a shared measurement framework. And I do think your question is a good one, though. We should see if we can find more, because as I think it's important to note, any collective impact effort worth its salt is going to evolve and emerge, both its understanding of the end game and how to get there, and shared measurement systems better co-evolve with it, because if they don't, they are going to be an enemy of collective impact, not a helper. So we need a lot more case studies of those, but I think it happens a lot, and I think it happens quite naturally.
Well, thanks for that. Just a quick follow-up to that. When it comes to that kind of learning as you go and the potential for intervening and changing the course partway through, how do you deal with the tension, especially when you're dealing with multiple perspectives or organizations, when there isn't unanimous agreement on making that course correction?
Well, I would say that that's a good question, and it's more of a strategy stewardship question than an evaluation question. Evaluation can generate data and insights that then raise these vexing questions for stewardship. I know that one of the things that I like as a principle of evaluation in general is 360-degree intelligence. And the idea is that no one is entirely wrong when they see some evaluation feedback and have conclusions about how to move forward, but no one's entirely right either. We all see little bits of the truth, and we really need good processes to get 360-degree intelligence and insight. So the collaborative decision-making processes, which is part of collective impact, that's really where the ticket is. And even having discussions where you agree to disagree and to say we will come back to address this later because we can't agree on it now, I think that's fine. You might have slightly different interpretations of what the problem is and how to address it. That's a governance issue, and good governance groups get better at dealing with tough issues over time and finding some ways to make decisions together even when people are not on the same page. So it's a long, it is an evaluation. It is a challenge that emerges out of evaluation, but it's primarily a stewardship strategy issue, and that's another arena for conversation altogether.
Wonderful, thank you. We have a question here from Nancy. Any recommendations for resources to further explain the agile approach?
Nancy, you heard me do the mea culpa online. If you Google agile, it'll come up everywhere. Software designers really know a lot about agile, so anyone who does management information systems will know about it. If you're looking for a popular introduction, there's a book that has agile processes baked into it. It's called Lean Startups for Social Change. And I don't know the author's name right off. I can see it in my bookshelf, but I don't want to leave the computer to get it. Lean Startups for Social Change. They have the Lean Startup language and model embedded in that. There's also a Lean Startup website that's very business oriented, but they tried desperately to make it useful for social change. And Zaid Hassan wrote a book called The Social Lab Revolution, where he also does some very nice framing around the agile approach. It's not as direct, but if you're framing it for colleagues, Zaid's book, The Social Lab Revolution, also has some nice stuff. So Zaid's book and Lean Startup for Social Change website and book should both be helpful.
This question is related in terms of adding capacity, either personally or within the organization, for measurement or evaluation more generally. Do you have any recommendations for training or resourcing or education more generally?
That is such a timeless question, Duncan, and thanks to whoever who raised it. I'm going to say if you're really committed, it's worth looking at the Canadian Evaluation Society, looking at their competencies and looking where training is offered. They have all the post-secondary organizations that offer training and evaluation, and that's if you're very serious, because they offer the most systematic pathway to getting good at that. The alternatives to that are both online book and simply like practice. The evaluation website, betterevaluation.org, is probably the best website on it is the best website on evaluation in the world, betterevaluation.org. They have very nice planning tools, tons of stuff on methodology, very well organized and easy to navigate and constantly updated. So there's an online website that's quite good. There's also a book called, we'll send it out right after. We sent it out last week too, Duncan, or a month ago. I think it's called Evaluation on a Run or Evaluation on the Shoestring. It's done by an Australian lady, Yolanda something, and she does a real nice job of trying to make evaluation really accessible for nonprofits. It is a book, so it's not a recipe-like approach, but she does wonderful framing. And the last thing I could advise is I think evaluation is a craft, and it's not easy to do. But if one says we are going to be a learning organization and evaluation is going to be a part of it, to simply commit to taking at least some parts of the of your organization and being as systematic as you can about evaluating them, doing it in small steps and small chunks, possibly even doing the agile approach, and allow your capacity to grow over time. There's no way you can do it in one fell swoop. Commit to a relentlessly incremental process of building up that capacity over time, drawing on systematic resources like universities and the abundance of online resources and books. That's possibly the best way to go about it.
No, that's a great answer. Thank you, Mark. And I've been writing down the names of books or resources as you've been explaining them, and we'll include those as a list in our post-webinar email. And I believe that brings us just about to time. So I wanted to take the opportunity to thank you again, Mark, for your presentation. And just wanted to thank the audience as well for your engaging questions and for joining us. The comments and questions really do add a lot. So thank you, Mark, and thank you to everyone for being here today.
Thank you.
And just before we go, I just wanted to share a few learning opportunities that Tamarack has in the near future. We have one that's just around the corner. We'll be holding a workshop on authentic engagement in St. Catharines, Ontario, with our very own Sylvia Choi. Sylvia will be discussing the authentic engagement of citizen leaders and delving into how to nurture these relationships and why it's a strategy that a growing number of organizations and municipalities are embracing. As well, we also have a new adaptive leadership masterclass series that will be led by experts Liz Skelton and Tamarack's own Liz Weaver. These one-day events will take place in Vancouver, Edmonton, Calgary, Toronto, and Ottawa beginning May 23rd. So we encourage you to follow the link on your screen if that perks your interest as well. Registration links for both of these events will be shared in the email that you receive after today's webinar, along with links to sign up for the next installment of this Diving Deeper webinar series. To learn more about upcoming learning opportunities, including workshops and free webinars like this one, please visit us at tamarackcommunity.ca. And we also encourage you to take a minute to complete a short webinar survey to offer feedback on how you enjoyed today's call. Speaking of evaluation, the link is on your screen and will be sent out to your email as well. Thanks again, everyone, and I hope you have a wonderful day.